Bipolar disorder, I think one should say, is a clinical condition and really a medical condition that has found its way in the classification of the psychiatric disorders that we know best and for the perhaps longest period also, caused by several factors, I would say, biological ones, perhaps some genetics, some inherited components, but often precipitated by stress-related and life events type of scenarios. Important to talk about symptoms, and perhaps if one has experienced it for the first time and not so sure what one is dealing with, it involves a couple of things. For example, changes in mood, and in bipolar with a manic presentation in particular, one will definitely be experiencing changes, elevated moods, almost agitated, sometimes irritable moods, and with that goes a change in rhythms, so to speak, a sleep pattern, eating pattern, and so forth. What goes with that is a psychomotor activity, let's say much more active, restlessness, driven behavior, driven experience, The question of how bipolar disorder is different from depression, I think, is an important one, because it's not from and upfront always so clear what one is dealing with, especially where bipolar can even present for the first time with only depressive depressive symptoms, and only subsequent episodes present with the other pole, so to speak, of the mood change, which would be the elevated or the irritable mood component. So I think in a way it is similar, first to start, to say that there are definitely also depressive mood components in episodes as well, and that it is separated by subsequent elevated and irritable moods. There are also the challenge of sometimes having mixed symptoms, where you may have depressive and irritable moods in a shorter interval of exchange. And so, to be aware of how exactly the mood features present is very important. It helps us also to find specifiers for describing the condition at that point. So being aware of depression versus elevated mood is actually a very important question. The role of age or in bipolar, or when it can start, and how long it may last. It's important, I think, to point out that problems and experiencing bipolar symptoms for the first time could be earlier in life, adolescents, younger people. The pattern or the cause usually to expect, it is often possible and to be expected that it will repeat possibly, and may have to be treated for a longer period and ongoing basis. With the correct treatment, though, it may be quite a positive message in that, and we can possibly come to the treatment in a minute. And so the ways in which we present with mood symptoms should sometimes also just be differentiated if one may possibly have a co-occurrence with something like substance-related presentation, or even medical conditions needs. It's a very important condition scenario to exclude when one assesses the presentation of symptoms with mood changes. I think it's extremely important to take effective action when symptoms occurs, and especially that first time presentation, to have optimal treatment and reduce the effects as far as possible. But the good news following from there is that once we have achieved stabilization of symptoms again, the chances are really positive and good in terms of maintaining one's life ahead, your work, family life, and so forth. So the message is, with optimal medication, that it is possible to continue having a normal life, continue achieving goals and objectives, and that is a positive message, even if it is a major fact to contend with once the diagnosis has been made.